Now. All right, so here we go. All right, so this is an informational session for our new program we're going to be launching for regional representatives. This is a program that we have been hoping to start for quite a while now, but it just, hadn't gotten off the ground. So I've been tasked with getting this started as the family support director for the foundation. So this is just going to go over what the program is going to look like. And then you guys can take the time to decide if you actually want to participate in it. So tonight is not a commitment by any means, literally just getting you the information about what the program is going to look like and what would be expected of you in this role. Okay, so what is a regional representative? Sorry, I might pause every so often because people are coming in. Okay, so a regional representative is a volunteer position for the SATB2 Gene Foundation under the Director of Family Support, which is me. This person is passionate about engaging with families in their immediate regions and being a source of peer support for those families. This person is also willing to learn about the state and local resources offered by the regions that they represent for persons with disabilities so that they can help families within their region find the supports needed for their loved ones with SAS. The person will also organize regional meetups, both virtual and in person, and all regional representatives are asked to commit to the position for a year at a time. I'm asking for that 1 year commitment because we want our families to know who they should be contacting, and we don't want it to be switching up constantly. Obviously, we understand if things come up and, you have an emergency or obviously our lives are very busy. So, if you have something that comes up where you're like, I really can't commit to this anymore, then we can talk about it. And I would be understanding to that, but I will ask that you don't commit to it knowing that you won't be able to give a full year of service. All right. So now I'm going to go over with you guys what each of those 3 responsibilities are going to kind of look like for you. So first we have the peer support. So as a regional representative, you're going to act as a peer support for caretakers in your area. There will be a training that we're going to be doing on this, and you're going to need to complete the training. It's going to teach you what peer support looks like, how to be a good peer supporter, and then most importantly, in my opinion, how to be a peer supporter without burning yourself out. So what does peer support mean? It means being a point of contact for caretakers in your region who have questions specifically about SAS, and being a listening ear when a caretaker needs to talk through something. What does it not mean? It does not mean that you're going to be counseling people. We are not professional counselors. We do not expect, nor would we want you to be giving professional counseling, mental health advice to our families. If somebody comes to you with something that's serious, I would expect that you would encourage them to seek out a professional. Now, that doesn't mean they can't share their mental health struggles with you. That's obviously completely fine if that's what they feel comfortable doing. However, we would ask that you don't give any sort of professional advice. Obviously, if you have something personal you want to share with them, go for it. But please no professional advice. And then also, it does not mean being available 24/7. There are going to be people who are going to come to you who are going to think that you are at their disposal constantly, and you're going to get burnt out really fast if you try to do that. So we're going to encourage you to, have office hours, so to say, where you are available to people, and then shut it off. Obviously we're all raising kids with SAS, so our lives are all very busy, and you have your own families to take care of. I do not expect you to just be available to everybody all hours of the day, all days of the week. So set those boundaries and stick to them so that way you don't burn yourself out. Okay, so that's peer support. State and local resources. So as part of the regional representative team, we would ask that you be passionate about learning about state and local resources offered in your regions for persons with disabilities. We do not expect you to be an expert on this, nor do we expect you to have all the answers. We just ask that you be willing to take the time to learn or connect families in your region with resources that can help them find the supports that they need for their loved one with SAS. Now this, we're not entirely sure how it's going to look yet because we just got an email recently from the Child Neurology Foundation that they're going to be launching a social services program, essentially, that sounds like it may fulfill this a little bit, which is unique. You know, it's something we've been looking for that hasn't been offered by anybody else. So if this, Allison and I are going to be joining their training meeting on this to kind of see what the program's all about. If this is something that actually offers those resources that we are looking for, then we would use them as a resource. As a small foundation and as a small group, it's imperative that we use resources that are available to us outside of our group, because we can't possibly have all the answers all the time. So if this resource is going to be a good one, then we definitely want to take advantage of it. Also, Child Neurology Foundation is a fantastic organization. They have a lot of really, really great resources. So I would encourage you guys to get on their email list, just as a caretaker, because they offer some really, really great advice for caretakers, and some really great resources. They do some really, really nice trainings. And that's actually who I did my peer support training through, which I will be in turn offering for you guys. Oop, sorry. Screen went away. All right. And then lastly, oops, too far. Lastly, we have the regional meetups. So the regional representative is going to be able and willing to organize regional meetups for families in their areas. To start, we would just expect that these meetups be done quarterly. So 3 virtual and 1 in person. Obviously, with the uncertainty of COVID, the in-person one could potentially end up being virtual as well, depending on the comfort level of those in your region. We're not going to tell you what to do one way or the other with that. If everybody in your region's comfortable meeting up in person, then go for it. You know, set your own limits and do what you're comfortable with. But we do ask that you do to start. We're going to do 4 meetings a year, meetups. You're also welcome to do more than that if you want. You're not required to, but you can hold as many Zoom sessions as you want, and you can set them up however you want. I just ask that you contact me, connect with me, so we can get that set up through Zoom for you, get the event invitations set up for you. And also, you know, I would like to be kept in the loop in terms of what, like if you're discussing anything topical, what you're going to be talking about. I don't need to know if you're just doing like a general meetup, other than to set the meeting up for you. Oop. My computer is being very touchy today. All right, so some final thoughts. So as a reminder, being on this call today is not a commitment to joining the program. You are not in any way committed to the program right now. This was just for you to gather information to see if it's something that you think you would be interested in, and to see if you have the capacity to participate in. I'm going to ask that you take the next week or so to think through the information that you heard tonight. And if you want me to send you the slides to read through again, I'm perfectly happy to do that. So you can think through this and kind of determine if this is a program you would like to be a part of. I have all these people joining now and they missed everything. So after like in the next week or so, once you've had time to think it through, go ahead and send me an email and let me know if you want to participate or not. And if you do decide that you want to participate, please let me know where you live, so that way I can get you connected to the proper region. Ideally, the way this program would be set up is we would have many, many, many representatives throughout the country, because there are states like California and Texas who I'm going to need multiple representatives for, because they're big states. And then there's other smaller states where we'll lump together a couple states. But just please let me know where you're from so I can have an idea of what regions we have covered. And then also, the peer support training is going to be scheduled for sometime in late April or early May. I am very, very close to having my 3rd baby. I'm due in like 3 weeks. So I'm not going to be doing anything major right now. And I'll need some time to adjust to life with 3 kids. So we're going to be doing that training probably sometime in late April or early May. We would also like to introduce all regional representatives at the family conference in July. You don't have to attend. Like, obviously we understand not everybody can attend the conference. But if you're not going to be in attendance, I would probably just ask that you give me a brief write-up of who you are and why you're interested in the program. so that I can share that with the people at the conference that are in your region. If you need any clarification or anything after tonight, please feel free to reach out to me. That's my email, thefamilysupport@SATB2Gene.org. So you can email me, or I'm also on Facebook. You can shoot me a Facebook Messenger message. That's fine too. But yeah, just feel free to reach out for any clarification on anything. And like I said, if you want me to send you the slides, shoot me an email and I can send them to you to look over in more detail. All right. Well, that's all the information I have for the program. So what questions do we have?
Jenna, for those that just joined us, can you go back to like maybe one of the first slides and have that up so that they can see it?
Yes, absolutely. I can do that.
Just
for Jessica that just joined us.
Oh, it's not just you.
You're not the only one, Jessica, but I would expect nothing less.
Okay.
I love you and I'm grateful. Thank you.
So what I'll do is I'll go through each slide again. I'll leave them up for like a minute and then I'll go to the next one so you have time to read through it. But while people are reading through the information who joined late, if there's any questions, go ahead and feel free to throw them out.
Yeah, I think that I just wanted to know about, so you mentioned about the Child Neurology Foundation. So,
yes.
And you mentioned, I just wanted to know just if you can elaborate a little bit, right? So how is that relevant to this discussion?
So they are starting a program that it's like a social services program where they would potentially have those state and local resources available for people who are interested in knowing more or like need those resources. Mm-hmm. So if their program is what we're hoping it is, then we wouldn't need to take on that responsibility as regional representatives. Right. We would just use them as a resource to help the people in our regions find the resources that they need. Because they're a much larger organization. Mm-hmm. And they can just offer more than we can at this point. So if that's something they're going to offer, then I would love to utilize that rather than putting all that work on you guys.
Sounds good. Thank you.
Mm-hmm.
The Child Neurology Foundation, if you guys aren't on their email list or follow them, I suggest you guys do that. They're an amazing organization who works with the rare community and disorders like ours who have a neurological, component to it. So they have a lot of programs that are already out there for, like Jenna mentioned, she went through a peer support training to kind of help figure out how to model this and how to train, our regional representatives. They have information from, how to prepare for a doctor's visit, just any doctor's visit, right? But preparing for a doctor's visits with these like amazing one-sheet handouts. So there's just an amazing wealth of resources that they have. So what we're really hoping with the training that they have coming up, like Jenna mentioned, is that a lot of this legwork that we've been trying to do to understand like what are the resources in every state. We're hoping that maybe this is what that maybe they've already compiled. And Courtney and Jenna worked on a project for us last year, and it's coming closer and closer to being able to push it out, a family toolkit. So, but one of the sections in that toolkit that we had, what we were trying to do was say, here's all the resources in your state. This is how you navigate the Medicaid program. Here's what you do when you're aging out. And then it became a really complicated project. It was, way more complicated than what we kind of anticipated. So we scaled it back and we said, well, we can't do this, yet, but, the goal would be, I live in Georgia, so I could tell families in Georgia all about the resources that we have here in navigating kind of the healthcare system, right? And so, Krista, I'm going to pick on you because I know you live in South Carolina, off the top of my head, so, then, Krista, like when I get a new family in South Carolina, we could say, hey, connect with Krista. She can help you understand what are the resources that are available, for your state. So hopefully that helps. I'm going to put the Child Neurology website into the chat, just so you guys all have it. Also,
yeah, it was quite an undertaking. Courtney and I found. Sadly, the information is just really not readily available. Like even when I went to look at my own state, which I am pretty familiar with, it just didn't match up with what I knew my state actually had to offer. So it's something that's going to take probably some old-fashioned work of making phone calls to local social services offices and connecting with local social workers to find out, what's actually offered. Plus, just your own knowledge with working with your own child of, for example, in Pennsylvania, we offer a medical assistance program for individuals with disabilities. Every state offers this to some degree, but it looks different in every state. So in every state, they have a program that you can qualify for with your child's disability diagnosis. However, some states, like in Pennsylvania, you qualify, all you literally have to do is send them the paperwork that shows the diagnosis. And I mean, Hallie in Pennsylvania even qualified with just the developmental delay diagnosis. And that was it. It was a very easy process. But in other states, there's more to it. You have to have a more severe diagnosis. Some states, there is a little bit of an income base where you don't pay fully for the program, or you don't get denied from the program because of your income, but maybe you have to pay a small premium every month because you make above a certain amount of money. So it really looks completely different in every state, which is awful if you ask me. Like, I think it should be federally mandated and everybody should get the same things in every state, but budgets and all that, politics, all that fun stuff. So so you would really be tasked with learning, or just knowing about what that looks like in your state, that and waiver programs, as well as just some other grant programs and things of that nature where people can get extra funding for therapies that aren't covered by their insurance and things like that. All right, any other questions?
I have one, Jenna.
Okay.
Is this a way that it could maybe be a shared responsibility? Because like we all have a lot on our plate, and I'm thinking, okay, I'm got to do this, 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 and this, and I already have a lot of arms in the fire, so to speak. And so I don't shortchange it, but I want to be part of it. If we have enough interest, could we share it with someone and be like co-representatives? Yes,
absolutely. Yeah, I mean, that would actually be ideal in my opinion. I would love to have multiple representatives from every state, so that way, it is a shared responsibility.
Or a region. And I also know our experiences are very different because our children are very different. So some might have more experience using resources, while others, child's not affected in that area, and they haven't had to seek that resource. So that's what I'm just thinking, because we're such a vast, unique community.
Yes. Yeah. And I mean, like I said, it would definitely be ideal to have multiple representatives from each area, each state. I would love to have it so we have at least one representative in every state. But then, like I said in the beginning, there's states like Texas and California that are just massive, where one person is obviously not going to be able to take that on entirely. Plus, also big states like California, I know different areas like the city areas and things like that have different legislation than you have in other parts of the state. So their local offerings are going to be different than in other parts of the state. Whereas with some of your smaller states, it's probably going to look exactly the same for the entire state. But yes, I would love that. So, and also, like I said on the page for that, I don't expect you guys to be experts in this, nor do I expect you to go out and find every piece of information that's available. I just ask that you be willing to try to find the information. And if you have a family that comes to you and you don't know the answer to something, that you put in the effort to try to find it. If you can't find the answer, you can't find the answer. Like you said, we're busy people too. We have our own kids and families to take care of. I'm not expecting this to be a full-time job for you guys. Obviously, it's a volunteer position. We're just trying to make a connecting point for our families where it's like, okay, I have this question. Can we try to find the answer to it?
And I to Jenna's point too, I definitely think it's a shared responsibility. And I think as like the momentum gets going and you start meeting and connecting with like more of the families in your own area, then it's like, somebody wants to be the one hosting a a virtual meetup, or or maybe somebody who is in your area is really an IEP expert, and you're getting asked, then you say, well, you start to learn who those people are and where their knowledge is. And that's kind of, for me, when I get contacted, first thing I do is, who do I know in that state? That I can connect that family to. Now that I have Jenna, I just push them all over to Jenna and let Jenna respond. But I haven't had that luxury until the last couple of months. So that's been the first thing I do is try to connect somebody that lives close by. Or if they don't live close by, who's somebody that has a very similar experience to what they've gone through. An example is a family a couple of years ago had a newborn, and was in NICU, had a lot of medical complications. And so, I kind of started digging through my Rolodex in my head and said, okay, I remember that this person also went through something similar, and then connected that mom, to that person. And you may not know those people, right? And it's perfectly fine to reach out to us too, to say, hey, I don't know how to, who to connect this person with. But I think as we start to build the momentum and you start to see the people that are in your area, then you start to kind of figure out who you can connect with pretty easy.
Yep. I'm looking through all your answers in the chat for where you're from.
I know. I'm trying to take notes of where everybody's from. Alice, I need your new address in Tennessee. I'll email you.
A lot of the middle of the country, which is good.
We'll have to draw a map, and
you'll have to have another one after that.
I love it. I think this is a great group. So
yeah, definitely a good start here. And then, just with families that you guys are connected with personally, if you can think of anybody who you think would be an asset to this program, and you want to encourage them to join us, obviously we only have a couple states represented here tonight. And we really would like to get somebody for all 50 and ideally even more beyond that. That's a big ask, I know, because we only, we're a group of only like 500 families, but I think, I think that there is definitely more people out there who would be a good fit for this program and who would be able to help us out with this. Any other questions?
So more of just kind of a comment that is maybe a question. So hi, I'm Chelsea Tewksbury. For those that don't know, I also have a lot of dogs following me, so I'm sorry if you hear them in the background. But so I'm in a unique situation. So I'm active duty military. But I'm looking at this chat here and I see we obviously don't have all 50 states represented. So I'm currently stationed in Ohio, but I've been stationed in Maryland, Texas, and I'm from New York. So if God forbid we're in a situation where we can't get representatives, I can't hold in-person meetings in those states, but I've dealt with all of those states firsthand for my daughter's condition. So
Great.
That is something that you guys need help. I can follow. I sent you an email already, but I can follow that up if we're short staffed.
Okay.
You go, girl. Wow.
Yeah,
That's amazing.
I am very known for drowning myself in work. So.
Oh my gosh. Talk about advocate of the friggin' year. You go, babe.
And thank you for your service.
Yes. All right. Any other questions or comments?
This might be for Allison. Do you know any other updates for the conference in July?
We are moving forward. We are currently have it bidded out to some new cities. Unfortunately, hosting at Arkansas Children's Hospital is not going to be feasible this year. They still have a lot of capacity limitations and restrictions on the meetings since it is a hospital. So we've kind of decided that we just need to move and find a new venue. So I will be presenting to the board on Friday the two final options that we've have and hopefully have a decision to be able to go back and negotiate further with a hotel. So stay tuned, give me like another 2 weeks, but we are saying yes, we're moving forward July 14th and 15th. So that's not the answer you want, but
Oh, no,
And
no, I'm
it's-
glad it's moving forward. I mean, the location can be determined, but yeah, just putting it on the calendar is a good thing.
We are, yep. So definitely everybody save the date. We're working out the logistics. I think we have some good options for new cities and hotels and places that are willing to work with us. So
Allison, are you going to leave that open for returning? Like, SATB2 returning folks, or are we going to, is it only to those that haven't really gone to a conference?
oh, it'll be open. I mean,
Okay.
right now, I don't think the cities and states really don't have meeting restrictions, capacity limitations in place at this moment. So we shouldn't have to cap our registration. There will be a registration fee, just, something different than the older conferences that we had at ACH when those were funded via a grant that we had. So we will have a registration fee, but right now we have not talked about capacity limits, so we should be good to go.
Cool. Thank you.
Um,
Yay. Yummy.
Stay ready.
We're here.
I'm happy to answer any other questions. So I don't want to take over Jenna, but if you guys have burning questions, go ahead and hit me up. No, you guys have questions about the regional program? Excited? Krista, are you going to dress your dog up again? Putting her on the spot.
We might dress her back up again this year.
Yeah.
Well, awesome. Well, if you guys think of things, right, y'all know how to reach me, but Jenna will probably be quicker.
Yep. Yeah,
Does
but a
you-
little bit less on my plate than Allison does.
When she has the baby though, she'll be busy, so.
After
At least
After
for-
her baby comes, I'm
program.
happy to take over the questions. So. But yeah,
All
that's
right.
why
Well,
we're
yeah,
kind
so
of
if you
laying the groundwork, let everybody think about it, and then we'll kind of hit it hard when she's ready to come back and join us. And
Yeah, you guys have plenty of time to think it over and really kind of figure out your commitments and see if this is something that you can or even want to do. Like this, no pressure. I know it's not going to be for everybody. If you've come on tonight and you've listened and you said, I'm not really sure this is the right fit for me, but I really do want to get involved. Don't let this, make you shy away from getting involved. We have plenty of other things you can get involved with. So, feel free to reach out to me or Allison if this is not the right fit for you, but you do want to get involved elsewhere, and we can definitely find something for you. But I do hope that, at least a good chunk of you will decide to participate in this. Promise it's not as scary as it sounds. It's going to be really easygoing, and I will definitely make sure that you're not going to be overwhelmed and being contacted constantly. I mean, I can tell you just in the time I've been in my role now with the board since June, and I've only had to send a handful of emails to families, and then I'm pretty active on the Facebook group as well. So it's not as big of a commitment as it sounds like. The biggest commitment piece is probably going to be really just hosting those meetups and also, taking the time to learn about your state and local resources. So, all right. Well, thank you guys for joining us tonight. If you, like I said, if you want to look over the slides again, just shoot me an email and I can email them to you real quick. And yeah, contact me with any questions you have. And then once you've made a decision about whether or not you want to participate in the program, shoot me an email and let me know so I can add you to the list. And I hope you guys have a great night.
Thank you. Have a good evening.
Thanks, guys. Bye-bye.
Thank you.
thank
Bye.
you. Good night, guys.
Jessica, I will email you.
Thank you. Do you need my email address?
Yes.
I got it.
Oh, Allison has it. We're good.
Or I could chat it.
We've
And then
got
I
it.
see that this is recorded. Can I get this recording somehow too?
Yes.
Because I'm at. the
Yeah, we're
program.
gonna Allison's gonna post it to our YouTube channel, so it will be there.
Y'all are the best. Thank you, ladies.
You're welcome.
Bye.